From Tragedy to Prevention, How Victoria's Voice Foundation Carries Hope for Families and Loved Ones, featuring Leah Shepherd. In this powerful episode, we sit down with Leah Shepherd, Executive Director of Victoria's Voice Foundation, to explore how one family's tragedy became a national movement for drug prevention education and naloxone awareness. Founded by David and Jackie Siegel after the loss of their daughter Victoria Siegel in 2015, Victoria's Voice works to equip youth, parents, and communities with tools to prevent substance use and overdose from happening. We also discuss the evolution of drug prevention in today's world, including the influence of social media, changing perceptions, and the importance of creating safe spaces for honest conversations between parents and teens. This episode is about prevention, compassion, and action, because awareness saves lives.
This is Talking Addiction and Recovery, the podcast talking, you guessed it, all about addiction and recovery. Join your host, licensed professional counselor Andrew J. Schreier, as he and his guests break down recovery topics with raw honesty, delving into niche conversations around the topics of substance abuse, mental health, and gambling. We intend to meet individuals where they are on their own personal journey of recovery, with dignity, respect, and compassion. We'll do more than talk addiction and recovery. We'll explore it. We're glad you joined us. Here with today's episode, your host, Andrew Schreier.
Our guest on this episode is Leah Shepherd, who serves as Executive Director of Victoria's Voice Foundation, the national nonprofit dedicated to drug prevention, education, overdose awareness, and substance use disorder prevention for families, youth, and communities. In this role, Leah leads the foundation's strategic efforts to expand and deepen its impact across programs including youth education, parent-caregiver educator support, naloxone access and awareness initiatives, and outreach to parents, schools, correctional institutions, and community networks. Under her leadership, Victoria's Voice has helped positively impact the lives of more than 1 million students, parents, educators, and community members nationwide through its evidence-based prevention and education efforts. Leah spearheaded the creation of National Naloxone Awareness Day, along with public policy and advocacy efforts that support expanded access to lifesaving overdose-reversal medication. As a key public representative of Victoria's Voice, she frequently engages in media interviews, public speaking events, and high-visibility partnerships that amplify the foundation's mission. In her leadership capacity, Leah implements impactful events that drive the mission across partner channels and oversees all operational and financial controls in collaboration with the Foundation's board of directors. She develops national partnerships, cultivates donor and government grant opportunities, and directs a team of dedicated professionals committed to executing the Foundation's life-saving work. Her leadership fosters passionate teamwork, strategic growth, and a steadfast commitment to protecting youth, empowering families, and strengthening communities nationwide. You can learn more about Leah in the podcast notes. Let's welcome her to this episode of Talking Addiction and Recovery Podcast. On this episode of Talking Addiction and Recovery Podcast, we want to welcome Leah Shepherd. Thanks for joining.
Thanks for having me.
We are going to talk about Victoria's Voice and everything about the foundation and some other things. Before we do, can you give the audience a little bit of background about yourself?
Sure. I'm the executive director for Victoria's Voice. We're a national nonprofit based in Orlando, Florida, with the focus of drug prevention education for youth and parents.
What got you involved or interested in Victoria's Voice?
It really started a lot with paying attention to the opioid epidemic that started about 10 years ago. And I really feel like this drug addiction and the drug overdose and really now fentanyl poisoning problem that this country is having affects everyone. It's kind of our generation's cancer. I don't know that there's anyone in my circle of influence, and probably even yours or anyone listening in today, that doesn't know someone who's lost a child, a parent, a sibling, a loved one to a drug overdose or now fentanyl poisoning.
Yeah, and I think there's something that I read recently where it was like 1 in 3 people will know someone who has died from an overdose. And when I was growing up, when I was in school, like that wasn't something that was common or happened all the time. We might have heard someone even later, but now that number 1 in 3 know someone, so it's harder to find someone that doesn't
know someone. I agree.
And the level of impact is also significant, right? When we look at like a community at large, we think about like it's not necessarily just someone within your family, but now it's so common to know about someone you used to go to school with, someone that you've worked with, someone that, so it wasn't just like a family thing. It was also now becoming more of a community impact that we've been seeing over the years.
It does. Yeah. Schools, churches, anywhere where you live, work, and experience your life, it's impacted by it.
I would say I don't always hear a lot about what's happening in Florida. And I say that because sometimes when we talk about different things with drug trends and stuff that's going on, there are some familiar places or things that come up with what's going on or what we hear about. What's been your experience, or what have you seen when it comes to like your area with just this impact or the work that you've done? Can you share more about just in your state, your area, where you've seen? I think that'd be nice to hear about.
Yeah. Despite what we're talking about statistics as it relates to hundreds of thousands of people who died, and the 1 in 3 who are impacted, the good news is that, believe it or not, statistics are going down. The CDC reported that in 2024, overdose deaths reduced by 24%. And Florida is tracking, when you talk about our community and where we are, on that national trend, and we're down 22%. So the good news is that the numbers are going down. And the experts are saying that two of the biggest factors for that are awareness, the prevention education that's happening in schools, these awareness campaigns, the one pill can kill campaign that you hear from the DEA, but also the widespread and knowledge and distribution now of naloxone, commonly known as Narcan. And when Victoria died, the daughter of David and Jackie Siegel, who started Victoria's Voice, when she died in 2015, first responders didn't carry Narcan. And it's hard to believe that because it has become so widespread and so widely known and was approved over the counter by the FDA in 2023. It's hard to believe that there was a time that first responders didn't carry it, but that was just a decade ago. And they
And Victoria's Voice, I've noticed, does a lot with naloxone, like education, awareness. I
Mhm.
want to ask you about that. Was a hard talk with families years ago. And I remember when we were first started talking about naloxone and having it, families were some of the reluctant ones to have it, to get it, thinking that it was going to do more harm or no, it was doing this. So I'm very curious as to with your foundation and working with families, is that what you saw earlier on? Have you seen a change in
Absolutely.
how
It's the stigma. It's the
families
stigma
are
surrounding it.
now?
Yeah. Yeah. And it, again, when David and Jackie were, didn't, when the first responders arrived, Victoria still had a pulse. So if they had had naloxone, she would have had the opportunity to still be around. And so that's why it was something that he focused on so much and funded first responders in the state of Florida, law enforcement officers at the very beginning, UCF, our state, local university here in Orlando. He funded their law enforcement campus police to have naloxone years ago before anyone was carrying it or had budgets for it. But to your point, yeah, the stigma surrounding it. I think we would do community fairs and different health fairs and things and give it away for free. And parents were like, I don't need that. My child doesn't do drugs. Well, first of all, you don't know for with complete certainty unless you're drug testing your child once a month that your child's not doing drugs. And secondly, it may not be about your child. It may be about the child in the backseat of your SUV when you're picking up the kids from soccer practice. And again, when we talk about with fentanyl poisoning, how prevalent that is. Now, you don't know what's in your kid's backpack. You don't know what they're having access to. And so we've really seen, I think a lot of it true, again, had to do with the FDA making it over the counter and making it more accessible. We're starting to see that stigma go away and parents being more willing to carry it. And we want it to be as ubiquitous as an EpiPen. And truthfully, if your child had diabetes or cancer, you would have no problem getting insulin or getting chemo for your child. If your child has drug issues or they could, there's no reason for you to not carry naloxone and let people.
Yeah, I often talk about it even to like we have fire extinguishers, fire alarms, and it doesn't encourage people to
Fire in your
light
kitchen,
fires.
correct?
And I've tried to find different ways of how to talk to families because there are times where families reach out or they and what I talk with family members a lot about is I've never had a family loved ones who have gotten naloxone, had access to it, and they come back and they say they regret it or they
Mhm.
say no, I wish I never had like, but
Sure.
I've had the stories of saying I wish I had it,
Yep.
or I don't know how I didn't have it before when I had the chance. So I've never seen someone come back to me and say, "Hey, I regret having this," but not having it is what I've heard far too often. And it's changed more today than a few years ago when we really started to see more of it, but it was a challenge. I'm glad to see more families and places that work with families and loved ones to see that change from where it was years ago.
It is, and it also, truthfully though, it for some families can be a little cost prohibitive. A box of naloxone, which has two doses, is $50. For some families, that could be their kid's baseball uniform. You don't know.
Yeah.
I mean, so for some families that can be a little expensive for them. So sometimes it's cost, which is why we try to go to as many, like I said, community fairs, health fairs, PTA meetings, and we have resources through I Save Florida through opioid settlement funding, where as a nonprofit, we're allowed to get a certain inventory and we give it away for free as often as we possibly can.
Yeah. That's great. I think to have more support with that is amazing. And it was when I looked at the foundation, there's these four pillars that are really outlined in what you do. And the number two was naloxone awareness and
Mm-hmm.
access. So for me to
Mm-hmm.
see that as like this isn't just something that we do, but this is a pillar of what we do. I thought that was so important to see because that challenge for a while has been there. So I really recognize that and appreciate that.
Yeah, and 3 years ago we launched. There's an awareness day for everything. There's overdose awareness day, fentanyl awareness day, opioid awareness day. There were all these awareness days. There's National Puppy Awareness Day. I mean, there's a day for everything, but there was not a day about the solution. There, believe it or not, up until 3 years ago, there was not a National Naloxone Awareness Day, and so we worked with bipartisan support from Senator Rick Scott from Florida and Senator Ed Markey from Massachusetts to create a bipartisan federal resolution. So it's not a bill, it's not a law, there's no funding assigned to it, but naming June 6th, which is the day Victoria died, as National Naloxone Awareness Day. And so we do an annual campaign around that, and we've started a Light Up Purple campaign where buildings, monuments, memorials light up around the country purple on June 6th in honor of National Naloxone Awareness Day. So if anyone listening in wants to participate, similar to a Red Ribbon Week or Breast Cancer Awareness Month, go to our website. We give you more details on how you can participate for free. Wear purple, light up purple, put a purple light bulb in your front porch of your house. We have purple bandanas for dogs this year. So we're
That's
getting we're
great.
getting the dogs involved. We've heard stories of naloxone saving animals and saving dogs. They are mammals. It works. Narcan works on animals as well. Dogs getting into drugs and overdosing and saving dogs' lives.
That's great. Thanks for sharing that. The the one thing that also stood out when making this connection was the book Victoria's Voice.
Mm-hmm. I keep
And
it with me everywhere I go. Yeah.
in that, wow, that was, and then for the audience, can you share with them, because I've read it, uh, you've read it. Can you share with them a little bit about Victoria's Voice before we kind of talk a little bit about it, but just what it is,
Yeah,
the book?
Victoria's Voice is the actual diary. It's the pages of Victoria Siegel's diary, starting from when she was about 12 years old up until she passed at the age of 18. And like all kids, she kept her diary, her journal hidden. Her parents didn't know about it. After Victoria died, one of her friends sent a screenshot of a text message that Victoria had sent to her friend saying, "If something happens to me, I want my diary published." And so David and Jackie, her parents, read the diary and made the hard decision and the brave decision to actually publish their daughter's diary, because it is a cautionary tale to any parent who thinks they know what's going on in their child's life, what's going on in their child's mind. And it really is something, I think, for kids. We recommend high school and up, not much younger than 14 reading this. It is for a little bit of an older audience. That it makes children, we've had feedback from so many students saying, this makes me feel like I'm not alone. I can relate to Victoria. I can relate to what she's going through. And the intersection of the mental health struggles that she had and the experimental substances that she was using conflated into ultimately an accidental drug overdose. And David and Jackie say, if you think this can't happen to you, it absolutely can. And so this diary starts with some introductory commentary about Victoria, the Siegel family, and then it goes into it's the actual physical pages of her diary that are printed that you can read, and you can see this child's downward spiral and what ultimately ended in her untimely death. And then at the end, we have solutions. We have some great resources for parents of places that they can go, whether it's the CDC, whether it's the DEA. I know those are a lot of acronyms, but it's different websites they can visit to understand how they can learn about the warning signs that their child may be having behavioral issues or certainly substance use. And it's meant to be a resource for parents and for children.
Yeah, and I like how you put the hard and brave decision to release this because I can't imagine the back and forth or the do we do this, do we not? Like what,
Right.
we're releasing something that pretty vulnerable, like
Personal and it's private
a
to a family.
diary. Yeah, like
Yeah, I mean, you're managing the grief of losing a child, and then wanting, springing into action, saying we don't want this to happen to one more child, and certainly not to parents, and for them to endure the grief that we've endured. And if, as embarrassing as some of this may be, if one person reads this diary and one child's life is saved, then it was worth it. And we don't charge for the diary. We pay for the publication. These are distributed. We have speakers across the country. We have bereaved parents that we've labeled our angel army who've lost a child. Some of them are siblings that speak who've lost a sibling, and they go out into schools and talk about their experience, and they distribute the diary for free.
that's amazing. What went into that decision to make that so? Because you don't hear that very common with books.
Yeah, it was. We toyed with the idea at the genesis of the organization of charging even a small fee, $5, something like that. And it was very important to David Siegel, the founder, that nothing come in the way of a child reading this diary or a parent reading this diary. And if that $5 stops them from being able to read it, then they could potentially die without this life-saving diary. And so that's why we have the funds, we raise the money for it. We have some existing funds from the founders, and we just don't charge for the diary. If someone wanted to go online on Amazon and buy it, it exists, it's there. But at schools and again at the different conferences where we visit, we give it away.
It's amazing. I don't think of. I'm just trying to even think of some other example where that is, and I'm sure there might be other, but that's just not a very common thing to have. But what a message too, right? Like we want to make sure. And what I appreciate is, and you mentioned this with naloxone, you mentioned this with even a $5 book, is that that can make a difference when it
Mm-hmm.
comes to access for an individual, for a family, where not wanting that to be like you're really talking about removing as many barriers, including financial barriers, which are
Sure.
really hard to address to make sure that this does not have anything more to prevent this from getting into someone's hands.
And we do actual surveys, and the students in school, the high school assemblies that we would do a pre and post speaking engagement survey because we need data. We want to understand is what we're saying, is our messaging getting through? Does this change your attitude towards experimenting with drugs? Do you have a better understanding of Narcan? Because we do demonstrations on how to use naloxone at the end of the presentation, and we collect that data. Only about approximately 18 to 20% of the students actually take the survey because they don't have to. And we had toyed with the idea of, okay, you get a free diary if you do the survey, trying to collect more data. And our board even said no, because if a child doesn't get the diary because they didn't take the survey, that's one kid whose life could have been saved. And so we can't even require them to take a free survey to get the diary. And that's how important it is that any child can read this and it saves them.
I'm curious. I remember my days of drug talk, whether it was from school or the commercials that used to be like I was young when the commercial of the egg frying pan.
Here's your brain on drugs.
Yeah,
Yeah,
yeah. So I'm curious from your experience, what you remember in your days of drug talk or drug awareness
sure.
from how you're doing it with Victoria's voice. Are you learning that there's other ways to reach kids or talk to families? Are there some things that still say the same with how
Sure.
we have those conversations? So I'm just curious on where you are with from what you might remember or what others may
Yeah.
remember from learning about things in the past to where we are today. What are we seeing as far as how to approach youth, how to talk to families
Yeah.
and stuff? So I'm very curious what your experience.
I grew up in the Just Say No generation. So that was, Nancy Reagan's big platform when I was growing up. And Just Say No works great if a child who never started doing drugs. But once they start doing drugs, Just Say No doesn't work. So the approach is the same in prevention, just preventing them from ever experimenting or trying in the first place. What we're battling now that's different than what was going on in the 80s and even 90s is the mainstream use of marijuana, how it's been desensitized, and marijuana is so prevalent. And parents from my generation going, well, I smoked pot in high school. It wasn't that bad. This isn't the same pot that we had access to in the 70s, 80s, and 90s. This is a much stronger, much different type of marijuana that kids are
Yeah.
getting access to. It's highly addictive. It's highly dangerous. They will start doing other drugs once they start this. The data shows once a kid starts vaping, just vape, people go just vaping, which is highly addictive. The likelihood that they're going to drink and do other drugs goes up by 20%. So if they start drinking, the likelihood that they'll do drugs, all of these are interwoven. Any use of any illicit substance, whether it's vaping, smoking, marijuana, or alcohol, has a tendency to lead to others and lead to a higher rate of addiction when these kids grow up into adults. But back to your question about what it's not so much that we're doing different, it's still prevention and it's still telling kids not to do drugs. The accessibility is different because now we're combating messages on social media and other realms that didn't exist even 20 years ago. And so your competition level of getting their attention and preventing them from having it. I mean, kids can get drugs on their phone, and you know that. I mean, they're going on different apps, um, Snapchat, all of those, being able to access drugs that didn't exist. And so it's combating accessibility and all the competing messages that makes it even harder in this generation.
Yeah, and we see that a lot too with I do work with gambling, and we've been
Mhm.
seeing that with the gambling on apps and some of the things that now make it even easier to do than before,
Mhm.
and stuff like that. What do you see works with when you have these programs? You got a lot of programs, a lot of events that go on. You have so many different things of trying to provide this support and services. What do you see your audience is receptive to? Is it someone sharing a story? Is it someone engaging in a conversation versus just telling them stuff? And they like, what do you notice is really receptive from the audiences that you speak with that really seems to have an impact on this type of topic?
Yeah, it's exactly what you just said. It starts with this personal story because when it's personal to someone, when you get a bereaved parent, when you get someone up on a stage in front of a group of students who's buried a child and tells those kids, don't do to your parents what my child did to me, but walks them through what their child was experienced, whether it was a one-time substance use or an ongoing addiction, kids listen to these parents because it's personal and because it's real. The second thing is what gets people's attention is it's they feel like they're not alone. They can relate to what you're saying. And so again, I go back to this diary of kids reading this going, oh, so I'm not the only one who feels insecure. I'm not the only one who's I'm not it people don't want to feel alone. We do a parent education program called Vital Signs, and you'll get these parents in a room and they're still, again, I go back to the stigma and shame. There's sometimes they're afraid to ask questions, but if another parent raises their hand and goes, I had an experience with my son the other day, and they'll go through an example, and another parent will raise their hand and go, "So did I," and then they feel like they're not alone. And so that shared experience really helps to get our message through when parents feel like I'm not the only one battling getting my child's attention. And also, again, it's the personal story, like I mentioned, makes it much more relatable than a law enforcement officer coming in. They're like, well, of course, a cop is going to tell us we're not supposed to do drugs. That's their job. But when a parent who's buried a child comes in, it absolutely is more relatable to students and to parents.
And I think those spaces that you create are so important because from my experience, when you can get families in a room together, or people in a space together, it's so much different than when we try to have the conversation over social media or through comments and other things. Because one thing I've noticed, I'm curious what your feedback is on this one, is that sometimes I see family members struggle And some of the most unkind comments sometimes come from other families. And to me, I'm like, I struggle with that because I'm like, this is whatever they're going through is hard enough already. It's so much. And then when you experience shame from other family members or other parents, like that just compounds it. So what what have you seen or what would you recommend for how we can break that more to where I want to be able to empathize with you because I'm a parent, or I want to be able to connect with you because I have a child, or because I was in that. I think your spaces where people get together
Mhm.
is one of the best ways to do that because then you're sitting with somebody, you're seeing another person, you're hearing their story versus you read an article about it and then comments come out and stigma occurs. So how do you think we can work with families and parents to just have more compassion to someone who is struggling? Because you might not be struggling now, but you might be struggling later.
Yeah.
You might not even know it's happening, and then you're the one that is dealing with it for a little bit. So
Well,
feedback you can give on that.
right. It goes back to the old saying is you've never walked a mile in someone's moccasins. And it's easy to be judgmental when a parent has lost a child to a drug overdose, going, wow, boy, they really failed as a parent. You have no idea what that parent was experiencing. You have no idea how that child got into drugs. You just don't know. And I don't know how we teach people to be compassionate. I don't know how we teach people to be non-judgmental because I think at some point in our lives, all of us have been guilty of it in some way. I think it's teaching the parents and having these brave parents like in our angel army who are willing to not let shame or embarrassment stop them from getting up and going to a PTA or a school assembly and saying, this happened to me, don't let it happen to you. And providing opportunities for parents to ask questions and not feel stupid, because none of us want to feel stupid. We've actually even started getting great response and interaction from
Mm,
football coaches, from baseball coaches. For some of students, that is the trusted adult in their life. Some of these kids don't have a parent or two parents at home, and that coach could be the person they go to for advice and counsel. And so, and kids spend more time at school and in after school activities with their friends than they do at home with their parents in those adolescent years. And so it's also not just thinking it's just the parents, it's the caregivers, it's the coaches, it's the teachers. It could be a guidance counselor at school, it could be their youth minister at church. It could be that cool, aunt down the street who everyone on the street calls Auntie whoever, and that's kind of the woman that girls go to talk to when they don't want to tell their mom things.
yeah,
But
yeah.
it does take a village to raise a child, and I think it's the more we talk about it, and the more mainstream we make substance use, whether it's drugs or alcohol, the more compassionate people are. It's going to come from people who are suffering grief, telling their story and making it okay.
There was I've worked with some families before. I'm curious if you've seen this where there's like the individual story. So it's, Victoria's and what she went through. There's also like the family story, right? About like what the family has gone through. Then there's also sometimes the individuals in that family. So the dad, the
Mm-hmm.
siblings. And what I've noticed is, and I've seen, this is why I even like to hear speakers speak again. Like I like seeing speakers as they continue to tell their story because sometimes you realize they're still learning new things. They're still understanding stuff that they didn't know before. So I'm curious, like when you work with someone who's the one story is hers and really based on that, but also this is a family we're talking about. There's other people impacted and how those stories get interwoven between some of the work that you do because sometimes I imagine it's also the parents talking about what they went through or a sibling talking about what they went through, not just the one person and what they experienced. So have you seen where there's now this mix of stories or these
It is.
experiences happening and then it's like this tells us why it's about more than one person. This is about a family, a community,
Right.
because this isn't
Well, it
just
is.
one
Yeah.
thing.
And we've had parents. In fact, one of them, Greg Swan, said, I only knew my grief. I only knew my world when my son died, and finally 6, 8 months into it, was looking over at his son one day, realizing he's lost a brother. I never even thought about his experience. I never even thought about his grief. He's now lost his brother, who he will never have for the rest of his life. My son will likely outlive me, and he won't have that sibling with him for the rest of his life. And I don't know what his light bulb moment was, but to have a father say, I was so consumed with my own grief that I didn't even realize that my son's brother was grieving too, was a real aha moment. And I would imagine that happens in a lot of families, truthfully.
Yeah, I always appreciate that there's there's still a lot of things that happen, that change, that you go through, and as you continue to experience that, it's incredible sometimes to see how people reflect back on so many things, but then also think about like what this means now and what can be done differently. Like I imagine Victoria's voice is still trying to find ways to continue to spread awareness, spread knowledge that this isn't okay, well, here's this, we did this, and now, but it's still like imagining where it might be in 5 years, in 10 years, that it's going to have some changes based on what's going
Well, the problem's never going to go away. It doesn't matter. It's whack-a-mole. I mean, President Nixon back in the 70s declared the war on drugs 50 plus years ago, and that's when the DEA was started. And so our country has been battling this for 50 years. And as long as human beings behave like human beings, the desire to experiment and the desire to have an altered state of mind, I can't fathom is ever going away. It's how do we make it as least lethal as possible and try to discourage as many people from allowing whatever mental health issues they're dealing, behavioral issues, and turning to drugs as a way to soothe their pain and escape whatever they're dealing with at the moment.
on. Yeah, very good point. What have you learned from your either your role or just your experience with being at Victoria's Voice? What has some of the experiences or some of the work have taught you either about substance use or about working with families or just a lot of systems. It seems like there's a lot of systems you work with, whether it's family,
Mm-hmm.
legal. There seems to be a lot of uh, partners that
Yeah.
are involved in some of this. So, any kind of things that you can reflect on as to being in this position and working at Victoria's Voice, you can sit back and be like,
Yeah. I
"No, this
mean,
taught me a lot that I didn't think I was going to learn or know
I've
about."
learned that there's a lot of hands in the pot, that there's a lot of great there's no shortage of nonprofits that were started by parents who've lost a child, whether it's to drug overdose, accidental, drowning, car accident. What I've learned more than anything is parents want two things out of this. They want a place to pour their grief, and they want to know that their child's life had some sense of meaning. And that's why you'll see so many parents start nonprofits, similar to what David and Jackie. And then third, the awareness so that nobody else loses their child the way it did in that. And what I've learned is that there is this nationwide network of amazing parents and nonprofits doing fantastic work in this space. So the effort is there. There's a lot of great free resources through the DEA, and other national nonprofits to give parents the tools they need to be able to have conversations with their kids. Our Vital Signs Parent Education Program has taught me a lot. What I've learned in that is learning to recognize the signs of whatever emotional issues or potential substance use issues your child may be having. Um, but I've learned that there are people really care, and there's so many parents that are working together to try to stop this epidemic.
Yeah, there's. It's amazing sometimes how you can feel so alone,
Mhm.
and then even knowing there's not just one person, but several organizations or several places out there that I think there's always that little balance of I feel alone, like no one else understands this or no one else goes through this, and yet, you know, here there are several places that can connect you with people who've gone through something similar. And I don't think there's, and I think the message isn't that, hey, you're going to find this person that knows exactly what you've been through or what it
Mhm.
was, because that was your child, that was your loved one. That's there's nothing that's supposed to replicate that exactly, but there's someone that has been through this and someone that is there to sit with you through what you went through. Like
Mhm.
it's so I think like that messaging's really, really important. And I agree with you. I see a lot of names of organizations, and every time it's tough because it's you know what happened or something that
Mhm.
was likely to have happened that now created this, but also just remember in my time, as you're saying, this is not new. This is going on for a while. But I remember when I was younger, probably couldn't name any organization that was started by like a family member. I think the only one was Mad. That was really
Was honestly just going to use that exact same example when that sprung up. And boy, is that not the textbook case of a group of moms turning something into, a nationwide movement that has had such tremendous impact, and still does. They still do such great work.
and now I'm like, there's so many different names of organizations based
Mhm.
off of families, and
Yeah.
it's that balance, right? Of like it's amazing to see that because there's more support and resources. Also, that experience of grief, knowing that what this family and community and loved ones
Mhm.
experience too. All right, one more question before we wrap up is what when we look at Victoria's voice and we sort of look at where it started, where it is now, where do you see like her message really resonating today? I mean, there's so many programs, the events, the diary is still out there.
Mhm.
Where do you really see that her voice resonates with people that are listening and also those who haven't yet heard it?
Yeah, I think it resonates with students and parents. I really do. I think our audience, both age ranges that we target, it really does. It's again, I go back to the kids don't feel alone in this, and understanding that they aren't the only one who are struggling with mental health issues and with just feeling like I don't belong. And where am I going? And what is life all about? Their brains literally are not fully developed. They aren't equipped to handle some of the stressors that they have that you and I didn't have. Social media didn't exist. I mean, the things that these children are faced with. And then I also see our message resonating with parents of finally getting it going. Same thing. I'm not alone. I'm not the only one who struggles figuring out how do I have a conversation with my kid? How do I keep that communication going? They come home from school, they throw their backpack on the couch, they go to their bedroom and close their door, and the music's on, and they don't want to talk to me. Well, how do I break through? And when we give parents some of these conversation starters and ways to try to communicate with their kids, it helps, and they're hearing it and it's working, and we get great feedback from the programs. We're going to keep at it as long as
Yeah.
we can.
All right. So final takeaways for listeners, either what you're working on, upcoming events, or just anything that you'd want to share with them as a wrap up to our conversation.
Sure. I will do a shameless plug for our website, victoriasvoice.org. All of our resources are free. We have a great vital signs, like I mentioned, parent education program. It's online. It's 8 video segments where parents can go through, and it talks to them about signs that their child may be doing drugs, whether it's low self-esteem, bullying. It goes through sexual behavior, alcohol, vaping, marijuana. All of our content is free. We don't charge for anything. And so I really encourage parents and students to go to our website and learn about our education programs and just learn more about the resources available to them for drug education prevention. And save the date for June 6th for National Naloxone Awareness Day.
That's great. And we'll have links to the website and everywhere where they can learn more and find out more about Victoria's Voice because there is so much. Like we couldn't
Mhm.
even break down every program, every category for the discussion, but there is quite a bit of things that Victoria's Voice has to offer. So it'd be uh, very wise for people to take a look at it and see all the things that are there. The book too, it was hard to read, but it's just so different because it
Mhm.
was really inside the mind of what she was going through and being able to share that very, like you said, tough but brave decision by the parents and we'll make sure that they can learn how to get a copy of that as well. So, Leah, I want to thank you for joining. It's been a really great conversation,
Thank
and
you.
the work that you're doing with Victoria's Voice and being able to share that on this podcast was greatly appreciated.
Thank you. I appreciate it. Have a great day.
You've been listening to Talking Addiction and Recovery with Andrew J. Schreier. We're so glad you've joined us and invite you to connect further with the show and these topics at www.andrewjschreier.com. That's AndrewJSCHREIER.com. You can also email us directly at talkingaddictionandrecovery@gmail.com and connect on social media, Instagram at Talking Addiction and Recovery, Facebook Talking Addiction and Recovery Podcast, and Twitter at TalkAR_podcast. To stay connected and never miss an episode, be sure to like, rate, and subscribe. Until next time, friends, let's keep talking addiction and recovery.